Most people don't really think about this often. I mean, I wouldn't assume people would, but during your peak periods of growth, as in during puberty, your skin has to stretch to account for up to 10 inches of growth during just 5 to 6 years. So, I mean, that's a lot of growth for just a small 5 to 6 year period. If you think about it, that's on average more than 2 inches of growth per year. It doesn't sound like a lot, but when you sit there and you think about, that might be 2 inches right there, but in just a year. So your skin has to stretch to account for that, your muscles has to stretch to account for that, and your bones lengthen to account for that. So this could lead to a variety of issues. My name's Evan, and today I'm going to be talking to you about a variety of researches I've collected on growth abnormalities, growth disorders, and just in general, what growing can do to your body throughout your life. So they can range from things such as growth deficiencies and stunting, which can be caused from growth hormone, like just how much growth hormone you receive, all the way to things like growth spurts, which can sometimes get out of hand and cause growth conditions that require medical attention, or even things as common as catch-up growth, which is more common in females, and I will talk to you more about what catch-up growth is shortly. So, to get started, this information I've received was done by a research at Conway Medical Center. So, on one side of the spectrum, as in too tall for growth abnormalities, we can see common things like growth spurts, which is just fast periods of growth, which can be coincided with things like stretch marks on your back or growing pains, which commonly happen in your legs, and they typically happen late at night between the ages of 11 and 14, and it's normally linked to an increase of physical activity. So those are normal. You wouldn't typically seek medical attention for just a regular growth spurt or growing pains. When you should seek attention is when these growing pains have odd things coinciding with them, such as warmth, or you have limited mobility, like you're having trouble standing on the leg that you're having pain on. This could indicate infection or inflammation. That's definitely when you'd want to go and seek medical attention. So some other possibilities, probably on the more severe side, are things like leg length discrepancies. So like maybe your leg growing at a quicker rate than the other, so you have a leg longer than the other, which could, you might need medical attention for that. It could cause life-threatening issues on the worst case scenario, but it also could just be improved by things like a specialized shoe or a prosthetic. So other things that could be possible are a rare disease called Osgood-Schlatter disease, which is a disease when tendons struggle to adjust to new bone lengths. So it causes pain and swelling and inflammation below your knee, just below your knee. So again, while that's rare, it's not insanely severe, but on the severest side of abnormal growth and severe spurts of growth that could cause issues is something called slipped capital femoral epiphysis, which is a hip condition when the ball of your hip joint slides off your thigh bone. So obviously that would require immediate medical attention, as it is typically, or genuinely and literally, just your leg falling off your thigh bone because your bones are growing at an abnormal rate. So again, as I said, this was all gathered in research done by Conway Medical Center, and I'd like to transition to go to a more common side of abnormal severe growth, as in too much, a spurt. So the most common form of a growth spurt and abnormalities, because this isn't common, it's probably at most 4% of people who experience this, and that's even 4% within the 4%, so probably even less, but is catch-up growth. So catch-up growth is essentially when people born small for their gestational age So people who are born with a growth hormone deficiency, during their pubertal years, they have an increased risk for this rapid growth called catch-up growth, where they will go from being short or too short their whole life to being abnormally tall or above average height, and they have an increased risk for obesity and things such of that nature. And while this could happen to males, this is most common in females. And this was all information gathered in a research done by Dorda Masni in 2022. So, furthermore, this catch-up growth, as is called, can be coupled with a synthetic growth hormone to eliminate the original growth deficiency that they were born with when they were born small for their gestational age. So, I'd like to transition again into a study done by Stefano Staggi in 2017, where he did some research on growth hormone deficiencies and disorders. So essentially, a growth hormone disorder is an endocrine disorder typically identified in childhood, as you can notice when your child is growing up below average height, because, you know, they'll go to class and every kid will be average height. You can kind of see that. But it is an actual disorder associated with the growth hormone. It's an endocrine disorder. And the best way to deal with this would be to identify it early on in life, as early as possible, typically within the first month of their life. It's recommended within the first 28 days of their life. If you notice this and couple it with this synthetic growth hormone, that you can eliminate the effects of the deficiency throughout your life, not only as you go through puberty, but if you continue this treatment up to puberty and couple it with this catch-up growth that you may receive as you have an increased risk for it, it can actually improve and eliminate the effects of your growth hormone disorder or deficiency for the most part. So that's recommended. It's cost effective to do it earliest on, and it is the most recommended form or way to deal with a growth hormone disorder, because a growth hormone disorder could lead to more severe effects throughout your life, like neurodevelopmental disorders, metabolic disorders, and just generally decreased cognitive skills and attention span throughout your life. Especially, researchers have noticed that children have a learning deficit and decreased attention span if they are impacted by a growth disorder. So while that's, say, the most uncommon form of growth deficiencies in youth when you're looking at the short side of the spectrum for growth abnormalities. So I'd like to transition into a study done by Ashraf Solomon. It's hard to pronounce that name. In 2021, he did a study on nutritional stunting as another possibility for, stunting throughout your life, which is most dangerous and characterized by, a deficit in nutritional requirements early on in life. So why that's most dangerous early on in life, like as in a baby in your first 2 years, your body is the most demanding during those 2 years. So because of that, it is recommended to, just generally make sure your child is well fed throughout their younger years and keep them healthy. But other than nutritional stunting, the last form of possible growth abnormalities or disorders is delays in emotional, physical, and environmental maturity because of a lack of environmental deprivation caused from post-institutionalized youth. So youth who are post-institutionalized or were bound in an institution like a hospital or an orphanage or a foster home for many years have a increased risk of delays in physical maturity and emotional maturity because of the fact that through all those years they had a deprivation of, a positive environment, so to say. In a hospital, it's all white, the walls are blank. So, or in a foster home, maybe you don't get like the care that you typically would with a mother and a father. So because of that, it could lead to developmental delays early on in life, and then obviously leading to growth hormone deficiencies, which could lead to all those bad things like cognitive disorders and whatnot. So to wrap it up here, a lot of growth abnormalities are rooted from a hormone deficiency or from too much of that hormone getting into your body or being put into your body and causing a condition based on how much you've grown. But as I've said, a lot of these conditions can be coupled or countered with synthetic growth hormone, or doing it at specific times in your life, like early on or during this catch-up growth period. Thank you for your time and experiencing this. I appreciate it.